about what if those pictures don't work for a learner that you're working with? So they don't understand like picture symbols. They need like real concrete examples, like the real thing. So first big caveat is do not show people pictures of real body parts, especially if they're under the age of 18, because then you are technically showing pornography to a minor. So don't show a picture of a real penis or a real vulva to a person to try to get them to identify the body part. You should, you could look at, I have some of these resources. People can reach out to me. I can consult. I do a lot of my consultation work is just around material preparation because I have some of these things that I can share with you. So one thing that I have used to create, say, like video models or teaching a task analysis is what are marketed as sex toys for adults, but they are realistic depictions, sometimes not so realistic, of bodies, and sometimes those can be used as substitutes. So if that's a need that people have, that could be something that could be facilitated. There are resources out there, so I will name one that's very commonly recommended called Handmade Love or Fingertips by Diversity Press. They are masturbation video models for people with penises and vulvas, but they show real people, and people will often recommend those to folks to help to teach effective masturbation skills or safe masturbation skills, privacy. But they are pornographic images, and so they cannot be shown to somebody who is under the age of 18 because then you are showing pornography to somebody who is a minor. In my work, I just make it a policy that even if I'm working with adults, for the purposes of teaching, I do not use pictures of real bodies when I'm teaching. So I'll find comic book kind of depictions. Some of those books could be on the resource list. Or I will use those sex toy sort of stand-ins for real body parts. But I think another thing, if you're a service provider listening and you're working with families and you don't, obviously teaching somebody about their private body parts, when you're a service provider and you're not seeing those body parts, that's where collaboration with families is important, because then you can talk with the family about, this isn't something that we can work on in our sessions at school, wherever. And the family can then take some of that kind of teaching responsibility for those private body parts that they may have more availability to teach because of routines like bathing and dressing and those sorts of things. So that's one way to help to address that. A few other questions centering around the idea of like, what if families or caregivers don't consent to access to sex education? And so I think that this is, where we think about how different people's backgrounds, culture, religion, all of these things play into people's understanding of sexuality. We need to sort of like recognize that different families may have different family rules around teaching some of those things. And we can teach some lessons, and then that's where supporting families to sort of say, here are our family rules around dating, around consent, around sex, around masturbation, and we can have some of those discussions. For me, the biggest thing to point out to everybody is that this is important, like I said before, because it's really like a safety skill, right? I feel like if I renamed my work or renamed this presentation like safety skills for autism, maybe people would be like, oh yeah, my kid needs safety skills for sure. And this is a safety skill. And so safety both in terms of abuse prevention, but safety in terms of medical safety and making sure that this can help your child communicate to you if something's wrong. I've had lots of families over the years when I ask, like, what's your biggest priority for your child? If their child's little and they aren't able to articulate their own goals yet, what are your goals for your child? And a lot of the times it's like, I want them to be able to tell me if something's wrong. And we want them to be able to tell you if something's wrong, like they have a tummy ache, but we want them to be able to say something's wrong, like their vulva's itchy, or their penis hurt, or somebody touched their vulva, somebody touched their breast. So focusing on the things that are going to create safety for the child in like their youth through their adulthood, so that they are not made more vulnerable than they may already be just by virtue of being a disabled person in an ableist operating world. So I think that the focusing in on the safety skills as a way to open the door, and just as a way for parents and caring professionals as well to start that conversation from a place of safety and caring. A few people asked about like impulsivity, and I think again that's like a bigger like behavior support issue, and so we'll get into that here. So, and this is a pretty typical sort of like learning scenario, is like they can say what to do before, they can say what they should have done differently after, but when it comes to like doing the thing in the moment, they can't do it. And that's just like practice and environmental supports. Practice and environmental supports. What's at the root of the reason why that person's having impulsive behavior? And a lot of that might come down to like executive functioning. Tune into like future ACT workshops about executive functioning. And so I'll talk a tiny bit about providing a behavior support plan that hopefully will address some of that. Some people were asking about like, can you teach autistic children about their or other people's body language? And I think absolutely, yes, you can. One thing that's could be helpful there is video modeling, right? We know video modeling is an evidence-based practice for teaching autistic learners. So videotaping them in a social interaction, watching other people, watching like TV shows and saying like, what do you see their body doing? Are they saying yes to this? Are they saying no to this? Sitting back and observing in a classroom or in a playground. So there's lots of ways that we can do that. And like, my opinion is like, yes, everybody has the capacity to be able to learn some of these skills. One person asked about teaching functional communication to ask for a bathroom to masturbate in school. I strongly advise against this. Primarily because the bathroom at a school is not a private place, it's a public place. And if you wouldn't teach other kids at school to go masturbate in the bathroom at lunchtime, then we shouldn't be teaching a child to masturbate in the bathroom at lunchtime just because they have a designation that gives them some extra support. We have to work collaboratively with home for sure. I've had a couple clients that I've worked with where we've been able to effectively address inappropriate masturbation because it's happening at school, which is a public place, by ensuring that there's access to masturbation at home. So that, again, privacy, the time and the place to be able to engage in that in an appropriate setting. The other thing is that we know that some people that we support have some challenges with generalization. So doing a behavior in one place and then overgeneralizing it and doing it in too many other places. So some of the cues around like a bathroom in a public place is then maybe they think that like, oh, it's a place with a stall and a sink, and then they might masturbate in like the bathroom at McDonald's or Starbucks, and then now they're masturbating in a public place. That's against the law. Now we're in contact with the forensic system. And that's another reason why, unless it's like absolutely necessary because of like the environment at home, that I also don't encourage people to promote the bathroom as the place where a person should masturbate at home if they have those generalization challenges. There's plenty of people that like they live and work like by themselves, and so maybe there are multiple places like in their home where they could masturbate, but those are going to be very specific teaching. So summary, no, I don't recommend teaching masturbation at school in a bathroom. If you're making a plan to transition that to home, like if it's happening regardless, and like the best thing to do to protect that person's dignity is to move them to or get them to a bathroom, because otherwise maybe they would be doing it in the hallway or outside, then we could do that. But definitely, and this person outlined that in their question, we need to have a plan.
What do you suggest for someone who has their hands in the pants and they have to wash their hands at school? So on one hand, they don't want to draw attention to the behavior, but there's also the hygiene concern.
I have thoughts. I will preface with like, people don't like my response to this question. You need to be more worried about the genitals going and washing the genitals than you need to wash your hands are way dirtier than your genitals. So I don't think that people need to wash their hands after they touch their genitals. I think they need to wash their genitals after their hands touch them. If we've learned nothing from the pandemic, it's that like our hands are gross. There's way more germs in that direction. So, but I get it. That's me. I'm like maybe a bit more flexible thinker in that regard. But yeah, like if somebody's been playing all day and then they reach in their hands and touch their genitals are going to be dirtier than their hands. So if it's sort of like a policy or people are kind of squicked out by that, or obviously if people are reaching into their like anus or rectum and there's fecal matter, that's a different hygiene concern than a vulva or a penis. If someone's menstruating and they're reaching in and then they have menstrual blood, that's obviously another level of concern. So I would just say, like, are there ways that you could reduce the attention, and what could we do that wouldn't necessarily mean like we have to go all the way down the hall or out of the portable, put on our coat and mitts because it's, we're in Thunder Bay and it's, minus 35, and, everybody now has hand sanitizer at the desk, so there'll be lots of leftover hand sanitizer when we're out of this pandemic. So everybody have hand sanitizer. So maybe we can just quickly hand sanitize. We can have wipes so we can wipe, and we don't have to have this like big delay. But yeah, I mean, I don't think that people need to wash their hands after they touch their genitals, but that's me.
Someone was looking for safe sites for like a 19-year-old who's vulnerable but maybe interested in dating.
Dating sites. There is like an autism specific dating app called Hickey, HIKKI, I think. I can add it to like my resource list. I can write it down that I will add it to my resource list so that I remember. So it's like an autism specific dating app. So it's neurodiverse people that are on that app. So that could potentially be it. I think the biggest thing, what is safe? I think it's less about like where are they going to get to make connections, and talking about like what are some ways that you can protect yourself if you're gonna like meet somebody online and then transition that into like an in real life relationship. So like a few things for people to be like aware of are just like, what are some of those like red flags of like online relationships that you might, so if somebody's asking for a phone number right off the bat, if someone is like showering you with like love and affection and attention, but then asking you to like send them money because, enter a reason. And then what are some ways you can keep yourself safe? Like just like a breakdown of like, before you go on a date, you need to tell somebody where you're going. You can like, take a photo. Maybe you like share your location with your phone with a care provider. There's a really good website, which will be on my resource list, called Scarletine, scarletine.com. It's a fantastic website that it's really text heavy. So it's for caregivers, it would be great information. Like they've got some really good breakdowns of like how to identify like online bullying, catfishing. There's like lots of skills that people need to know to keep themselves safe online. But also, I want to promote safety, but I also don't want to like over expect things of people with a disability just because they're disabled or just because they're autistic. Like, if we're looking at like, consent, okay, well, can you name all of the sexually transmitted infections, how they're transmitted, and what you can do to protect yourself against them? Well, like, find me another like 22-year-old or 19-year-old that could do that. So like, yes, that information is important for sure. Safety, like, yes, we should do it. But I also just want to say like, let's have some realistic expectations. But Scarletine has a good breakdown of like who, what to do to sort of identify some online stuff. Yeah. So a couple people was sort of like, what do I do if someone's masturbating in a public place or in school, like those kinds of questions. Definitely like the most common question that I get asked. And so it really is that it depends on all of those things that I just outlined, right? Like it's very hard to sort of say like what you should do right away because I don't know why that's happening, right? I don't know why that person's masturbating in a public place. Are they lacking knowledge? All of those things that we sort of touched on. So the most important thing I think is to like not just ignore it and hope that it will stop or that it will go away or that we'll figure it out. Is to sort of plan. So get together with your teams and make a plan. How can we help this? For most of the time, I'm assuming that's probably student. It could be families at home. So like reach out to the people that are in your care circle. Like reach out to professionals like myself around like, can we help to make a plan to figure out why this is happening so that we can address it, so that we can protect the person's dignity, safety, other people's safety. I think that it is important to like interrupt and redirect in those cases for public masturbation, certainly. So again, making sure that we've got people that are busy, really encourage you to pay attention to like what's happening beforehand, and figuring out what you might be able to do to help prevent it. If you have good communication between like different places where a person is being cared for, really exploring those options as well. So I feel like when I'm in a workshop, I want like an answer, and then I feel bad when I'm the person delivering the workshop and I also like don't have the answer. But the answer is usually it depends. Reach out and ask for help. I think the biggest thing is like there can be some like shame and embarrassment because it has something to do with sex and body parts. And so just really encouraging you that like this is something that someone can have help with. This is something that there can be a change in behavior if we're just all kind of willing to talk about it. And so today's like the first step, right? So you're here, you're talking about it, you're starting to get comfortable. Naming the behavior is a good first step. If I get an email from somebody saying like, I need help, my son is behaving inappropriately. Like I don't know what that means, but I understand that people have a hard time labeling it, but it's so helpful for me as a professional to know what it is that is happening, and for us to sort of like pay attention. So please reach out to your care teams, come up with a plan together, don't ignore it and hope that it will go away. Teaching some of those behaviors around some of those things. Some people were sort of asking in the chat about like workshops, and I see that some people were sharing some resources, which was great. There's another great resource called the Organization for Autism Research, and they have a sex ed guide for self-advocates, and it's a kind of like self-guided online guide that if people have good reading skills, they can use the guide, or it's helpful for like care providers to review the guide. The consultant at the beginning that I named, one of the autistic self-advocates that I have connected with, Amy Gravino, she helped to develop it along with many other people, including Peter Gerhardt, who I mentioned as like talking about the 5-year rule. This guide for self-advocates. It starts with really simple things like body parts. It talks about public and private, and it goes into like consent, dating, all of those sorts of things, healthy, unhealthy relationships. So that's a really great resource. It's called OAR, Organization for Autism Research. We'll put it in the link for resources today as well. I found that guide helpful just as even a professional. So if people are looking for some resources, I would love to set up sex ed groups for teens to participate in. Got a little derailed with that with the pandemic, but hopefully be back on track to be able to offer some of those things. And there are folks like myself that are doing like one-to-one education with students if that's an appropriate fit for them.
Do you need parental consent to engage in education about sexual health?
I guess that depends on where you are. Like that depends on where you are. I think if you're in a school, like I know the rules for here in Canada. So there are most places have just like sex education is embedded in the curriculum, and there does not need to be parent consent to teach sex education. Most schools will send home a letter out of courtesy to parents to say sex education is going to be offered on this day, and so just so you know, this person's coming in. Usually they bring in, often they bring in somebody from outside of a school district to teach sex ed. Otherwise, I would just say, do you get their consent to teach multiplication? Do you get their consent to teach social studies? like that's my personal opinion, but that I do think that it is like another lesson, particularly if it's at school, that like we don't get parent consent to teach the rest of the curriculum, and sex education is in the curriculum. There are some states, for example, that I know have like opt-in sex education, so you have to say like, yes, I want my child to receive it. There's also some places that do like opt-in by default, so if you don't say no. But there are a couple states that have like specific provisions in law now. We don't have as strong as a litigious society in Canada, so we don't have the same laws, but where it is mandatory now to provide adequate, accessible sex education. If you are in a school and you remove your child from sex education, the rule is that you have to show that you're providing an appropriate and acceptable alternative. So if you choose not to have your child in sex ed at school, you have to show what you're doing to teach them those curriculum objectives, in BC anyway, to meet that. If you're a service provider and you have a contract with a family, I think that gets a little bit dicier because if you're contracted by a family, then yes, they have to consent to sign off on everything that you're doing. When I start to work with older, but again, like we're teaching body parts, like you're teaching body parts. I think the best practice is to have those conversations with families and just talk about like, what about this is making you feel uncomfortable? What about this would make you feel more comfortable? Can I point you to some resources that you could use to get more comfortable as a parent or a caregiver? But yeah, I think if you're an independent service provider, just teaching it. When kids get older, I have explicit conversations on both sides with parents being like, I will tell you broadly what we're working on, but I won't tell you exactly what students are saying to me, all that. Or if a student says something to me and they say, don't tell my parents, I do not tell their parents. They have like, I will tell them like the broad things that we're talking about, but it does get a little dicey.
So for kids that are more ashamed or anxious or embarrassed about their sexuality or their body's, sexual body parts, how can you combat those negative associations and reduce the fear factor in having those conversations?
Yeah, I mean, I think that finding some resources that show the person models of themselves, and so sex education books that are more inclusive of different identities and abilities and those sorts of things, because lots of like the basic books sort of show like boy, girl body parts. And so if someone's like, I don't identify as either of those, there's a really great book, I'll put it in my list, called Let's Talk About It. It's a cartoon book by an author, Erica Moen, and her partner, Matthew Nolan. And it is a great book for teens that shows like a diversity of bodies, so like bigger bodies, disabled bodies, and having all of these conversations. I think so much is like seeing a person reflected on the screen. Another great resource is, again, I'll put it in the resource list, is called amaze.org, which is like a YouTube channel. And they have a lot of different videos on there with like, they're cartoon, but different identities, different body types, different people, so people can see themselves reflected. And I think that goes a long way. Finding those positive messages and pointing kids in those directions can do a lot to combat this sort of like stereotypical, like gender normed, like beauty culture. I mean, there's big issues there just around like messaging and self-esteem and like all of those things. So, but finding some resources that match like who a person is so they can see themselves reflected can go a really long way.
Similar kind of statements or questions in the chat about difficulty providing privacy to someone that when they're unsupervised, they can have some very challenging behaviors. So one example here was leaving a 16-year-old alone means also accompanying, urination or some kinds of self-harm related to their sexual parts. So I just wanted to give you an opportunity to speak to those kinds of issues.
Those concerns, yeah. Yeah, I think those concerns are very real, and so I think we need to sort of we need to find a balance between safety and privacy. But I think just sort of like being like, oh, I know how we're going to address this urinating in the bedroom. We'll just always have somebody in the bedroom with him. you're not doing anything, like, you know, you need to make a plan about how to get towards privacy. I can appreciate that can be like very challenging, can take a lot of resources, but what can we do towards that end so that that person can then have privacy, I think is just very important to consider. I'd have to know more information around like the self-harm to a person's body parts, like if they have a harmful or ineffective like solo sex or masturbation routine. Like I've definitely worked with lots of clients, so medical stuff for that for sure. Like what is the reason? So I've like done some consultation where people are causing harm to their penis because they were put on a medication that decreases their sexual responsivity. And so now what used to feel good with just like tapping their penis against their hand doesn't feel good. So now we're tapping our penis against the dresser. Now we're putting our penis between books. Like, you know, it just kind of escalates. So medical stuff for sure. And then teaching a safer solo sex routine, lubricant. Oh my goodness, lubricant for everybody, like can go a long way to just like preventing like chafing, harm, all of that sort of stuff. So yeah, definitely would need a bit more information, but I would say like medical, lubricant, focus on what can we do to get towards the end. If we're looking at like means to an end, focusing on skill development so that they can have some privacy.